Hello, and welcome to the Pet Healer Podcast. This is your host, Dr. Mitzi Vargas, and today we're going to talk about Adequan and any other glucosamine products that we like to use in our practice. I think that Adequan has been used for over 20 years in veterinary practices, and I feel that in consensus, talking to my colleagues, that is one of the products that really works. I remember for a while there was a Chondroprotect, which was a kind of like competing generic product. And I noticed the difference between the results, and I could be biased, but at least in the subjective pain scales, owners and ourselves noticed that it wasn't as efficient. Now, there are other alternatives than Adequan, but Adequan to me is very useful. And the reality of the situation is that 1 out of 5 dogs a year older, a year and older, will have signs of osteoarthritis. So people don't think that a 2-year-old can have severe polyarthritis or even arthritis in any joint. And that is a disservice for the pets if you don't think about it. So as part of the regular physical exam, we should do range of motion. Also gait observance, because when they walk in the room, you need to observe the dog walking. Are they stacking all those legs under? Or are they widening the base? Are they doing any of those alternative gait stances and gait patterns that are compensatory? Because that will give you like a clue to look for other stuff. As acupuncturists, we use the back shoe to check for pain. If you have reactivity of T10 area, bladder 18, I would definitely look for signs of pain. If you have reactivity of L2 or bladder 23, I would see for check for pain, do my range of motion exercise, and determine, because hip dysplasia, the old thinking, and I've been out way too long, since 94, and so the old thinking was that hip dysplasia will give you like 4 good years, the first 4, and then you start seeing clinical symptoms of hip dysplasia around age 5, and that to me is not true. I see it way earlier. And it's a sad thing to put a non-steroidal anti-inflammatory treatment, every day, all day long, 24/7 for these pets when they are 2-3 years old. I mean, if you're 12, 14, then, for example, my own dog, Daisy, she turned 15, God bless her, and she does have severe polyarthritis. And so I do meloxidil with her. I check her kidneys every 3 months. She's here today to check her kidneys, check her little baseline every 3 months. And she's been doing great with meloxidil daily. But that's in addition of her Adequan. That's why I wanted to talk about Adequan, because I use inspiration for this podcast is my everyday life. And I've noticed that Daisy, I have skipped two shots of Adequan on Daisy. She gets it monthly. And I continue everything. Her herbs, body sore, stasis of the mansion of the mind, her meloxidil, and all her little other supplements. And the only thing that changed was I forgot to do the Adequan 2 months in a row. So as we know, or I don't know if everybody, vets out there, do the same thing I do, but I load them up once a week for 3 weeks. And then after that, I would do Adequan once a month. I do Adequan in gallbladder 30, oftentimes bladder on Baihui, which is Baihui is lumbosacral, gallbladder 30 is the around the trochanter, the caudal aspect of the hip joint, really, in between the ischium and the trochanter. That space there is gallbladder 30. And that's where I put my Adequan. And it's wonderful there because we're doing double duty. We're injecting Adequan, but we're also doing the acupuncture point there. And so if you're a regular veterinarian listening for first time, then definitely I'm giving you the anatomical places, midline and lumbosacral space, that you can use Adequan there. I mean, obviously at the level of the skin, not at the level of the joint. And then the same between the ischium and the trochanter, you can have that area there, that fossa, that indentation there. You can put the Adequan there, and I have excellent results there. I also use it on SI9, small intestine 9, which is in between where the head of the tricep meets the deltoid, that groove. Put it right there. It really helps. So those are the places that I use Adequan in Daisy and my own dog. And I just noticed, so I said, let me just talk about Adequan because it's an oldie but a goodie. Been in the market for a long time, but it really works. And it is a polysulfated glycosaminoglycan. My goodness, I couldn't get it. And that is also really effective in horses. And so, of course, the large animal people use Adequan a lot. But for dogs, I feel like we under-prescribe it maybe. That we should try to, before we jump into non-steroidal anti-inflammatory, let's do something for the joint, because we know that it is proven. There's a specific studies that prove that you stop the loss of cartilage. And so if you have that protective effect on the articular cells, you're going to have shock absorbing power. You're going to have joint lubrication because those articular surface cells are going to produce the joint fluid, and you're going to relieve inflammation at the point of, the origin. And so also you're going to renew these building blocks that is like a matrix of the cartilage. And so it's going to repair some old, not only you stop losing it, but you might be repairing some. Now, we can't turn the clock back and restore all the osteoarthritis, but we definitely can relieve the inflammation as a higher degree using Adequan. What about using intra-articular injections? What is not approved for intra-articular, obviously, but I use a specific one, glycosaminoglycan that is for the joints, and I use it intra-articularly. And it's very easy to do the injection, especially for chronic ACLs. You just do dextometer, which is a mild sedative, and then just inject it at the site aseptically. Obviously, you got to prep it aseptically, but you can prescribe it in the lateral compartment, lateral to the patellar ligament and right above the tibial plateau. And it is incredible. I usually try to, if there's any joint effusion, I try to remove whatever amount I'm going to inject. If I'm going to inject a 1.5 cc's of the, injectable glucosamine in there, then I'm just going to remove the fluid first. And then with the same needle that's still there, I just inject that. Is the same treatment that I use for PRP. So the difference between PRP and that, obviously, PRP and Adequan work wonderful hand in hand, especially for the recent PRP. So with PRP, you don't want to do non-steroidal anti-inflammatories right away. Have to wait a little bit, allow that area to bring in the factors, the healing factors to the area. So you don't want to use the non-steroidals because you stop the process. So what I would recommend would be to wait at least 3 weeks after you've done the PRP to start the non-steroidals. But in that time, use once a week Adequan. So Adequan has saved my life. Now, I had done this before. I've done the injectable glucosamine, and it's called Polyglycan, the brand that I use. I don't know if I'm not, talking about brands here, but I do Polyglycan, and I inject it directly in the joint. And I have done Polyglycan and PRP together, but I don't know. I have mixed feelings about it. I tend to like to do one thing at a time. So then I have moved on to, instead of injecting those two in the joint at the same time. So I just do the PRP and then do Adequan. So anyways, I think that the Adequan can definitely slow down the osteoarthritis process, and it can definitely provide a fast relief. You would be very surprised how fast it is. And even if you end up doing a TPLO or a patellar luxation repair surgery, any of those processes, you still can use the Adequan. It's not like one or all, it's multimodal approach. So I hope that we don't forget about Adequan. It is definitely approved for dogs. It's been in the market for a long time. It is effective. And I just speak from my own experience. Daisy is not the same without it. So I'm back to my monthly shots for her. And I learned my lesson not to miss it. So I hope you learned something today. And if you did, just hit the notification button so that you don't lose the next episode, and just share it with your friends. And feedback, I love feedback, so you can send me an email, drmitzi@gmail.com, or any of the databases platforms that we have the podcast. Thank you, and I'll see you next time.